What drives me in my role in care management is wanting to see children live their best lives. Care management is innovative because we are able to really serve our families under one umbrella.
It involves the entire family and the extended family when appropriate to solve the problems that brought the family to the attention of the child welfare system. We accept them for who they are, where they are, when they are, and are determined to work in such a way that we all go forward together.
We take on the role of the child welfare agency. We are the decision makers. We are serving the families, providing legal representation in court. We make decisions about removal based on safety. We develop a family case plan that encompasses all the services that that family might be in need of. Probably the most striking impact that I've seen over the course of the years is the impact that we've been able to have with reducing our paid care rate. And when I say paid care, that means children being served in a setting such as foster care, a residential facility, an emergency shelter care group home.
We have our own food pantry, that we have our own psychologists, our own psychiatrists, our own parenting program. If a care management case closes, they can continue with their counseling services. You know, it's more of not even a team effort, it's the individuals that are willing to do the job.
NYAP helped me get in a safer environment. I was really struggling during that time, so having them as people that I can talk to, having places to stay where I can be safe, helping me emotionally, I wasn't doing well emotionally, and helping me stay on track because I had a lot of goals and things that I wanted to achieve. I think it was really important to still have community. I am going to school for computer science. I want to get my bachelor's in computer science. I would tell my younger self that it's gonna be okay, and everything that I wanted, when I was a kid, I'm gonna get it because I have a robust support system and I am determined.
Social work has its standardization. It's actually the social work experience that informs the case more. Dynamics of addiction, people without a home, how many moves for this child becomes detrimental. I thought NYAP was good at that creativity because you didn't really need to be creative to get removals. You needed to be creative to reunify.
I had lost my kids due to drug usage, and I was introduced to this Ohio Youth Advocate program, and my case manager was Najia at that time, and she came in, she sat me down, she spoke with me. We just went through everything. I cried a lot, but for some reason, looking at her, I was able to be completely honest for the first time in a long time. So we went on a journey together. She was stern, she was hard, but it was good for me. She was also like a mentor towards me. And today, here I am, I have all my kids back. I've had them back 16 years. I've been clean 16 years, and she is still my mentor and sponsor and friend. They were always there for me, They took this personal. We really want to help this person get themselves together. As soon as I walk through the doors, I'm at home. This is my second home, so yeah, I love this place. I love the people in it.
Because care management has a focus on working with families positively and productively within under a year, we're able to predict and project costs in such a way that it allows referring agencies to have predictability. Care management allows us the freedom and the flexibility to coordinate and arrange services in the way that is most meaningful to that family and consistent with the individualized needs. Many of the contracting agencies that we work with have difficulties with increasing numbers of children going into paid care, and it wreaks havoc on budgets throughout the country. And we're very energetically focused on creating families, finding families, helping children to live in the communities that they know, to live in the communities they call home. Whenever we can serve a child and a family safely without using foster care, it's a win the whole way around.